Hey everyone, good day to all. Today in this video, I am going to discuss about the types of leukemias. Okay, this is very confusing topic. Okay, so you have to listen very carefully. At least remember these points to solve any MCQs regarding the leukemias. Okay, so first of all, guys, we are having the CML chronic myeloid lymphoma, AML acute myeloid lymphoma, ALL acute lymphoblastic leukemia, CLL chronic lymphoblastic leukemia. First of all, you have to know what the hell is that. Why is these leukemias are occurring? Suppose example, guys, this is the industry. Okay, this is one industry. Okay, there are one adult guy and there is one small children. Okay, na? If adult guy goes to factory industry to work, then the work will be good. Okay, na? What happens if this guy, 10 years old guy, go to the industry for work? Will industry run? No. Like this only, blast are immature cells. They are going to different parts of our body and they are not performing any function. That's why leading to the leukemia. Okay, so we are having the this is for the understanding purpose I just told. Okay, so this is the chronic myeloid leukemia. Okay, so this one, guy, this is very important. Okay, now, so first of all, so CML, it occurs in the more than age of 50, more than age 50 years. AML mid age, it means less than 50. ALL, this is occur in children. See, children. Okay, na, children's. And CLL, it occurs in the old age. Is it clear? CML more than 50 years. AML less than 50 years, mid age. ALL children's. CLL old age, 65, 70, 80 years old. Okay, so CML is very important. So see here, it is due to the translocation of the chromosome 9 and 22. 9/22. Okay, now. So, and the chromosome is that ABL-BCR. See, ABL-BCR. This is called as Philadelphia chromosome. Last time question they asked that which of the following is a Philadelphia chromosome. So in the option this was T, translocation of 9 and 22. It's the ABL-BCR chromosome. Okay, CM. Okay, now. CML, T, translocation of 9/22. Okay, now, first of all, guys, see this one. See the symptoms. Symptoms are leukocytosis, means more WBC. There is a basophilia, means more number of basophils. See, in basophilia, see, if you see this one only, then mark the CML, basophil, more basophil. There is always reduced RBC. Everywhere you can see there is a reduced RBC. That's why the color is pallor. The patient will be very lethargic, bruises, there's night sweating, anorexia, weight loss, hypersplenomegaly. Splenomegaly seen is everywhere, but there is a hypersplenomegaly. Okay, see that's what you see here. If you see the CBC report, all the reports are increased. Platelet count increases and clotting factors increases. Everything increases. Basophils, neutrophils, everything increases. That's why it is called as garden party appearance. Okay. So see what is the investigation choice is the PCR for the BCR gene. Okay. For the cytometry, we'll see the NAP, neutrophil alkaline phosphate, and also you see the lab. Okay, now, so in the cytometry, you will see these values will be always low. Just remember this one, low, always low. Okay, now, so what is the treatment? It is the imatinib oral tablet given for the 18 months. Okay, see, all the symptoms are similar in everywhere. Okay, now, remember this one, CML is very important. Okay, now. Okay, mostly they are going to ask the CML. Coming to the AML. AML occur in the mid-days. Okay, now address about 50 years. So see this one. See here, this is happens due to the translocation of the 8,21 and translocation of 15,17 and the inversion of 16th chromosome. What is the 8,21, 15,17 and inversion of 16. Okay, na? So translocation of 8,21, it occurs in the AML type 2. See, AML type 2, 28, T8. 28, okay, na, see, 2288, TT, 28, okay. So T821 is a AML type 2. 15, 350, how much? 350, 15, 35, see, 15, 17, see, 15, 17 is a AML type 3, okay, na. Inversion of 16, it is type 4, see, 4, 16, so inversion is the inversion of 16 is seen in the AML type 4. Okay, so among all AML, AML2 is the most common. AML type 2 is the most common. Okay, na? So in coming to the AML type 3, guys, this is the main important questions are asking. AML3, it is called as acute promyelocytic leukemia. It is called as acute promyelocytic leukemia, which is having maximum RRODs. Maximum RRODs. RRODs are not seen in the lymphoblast. RRODs are seen only in the myoblast cells. Myoblast cell, you will see this one. There is a band like this. There is a band like appearance. So if you see the RRODs, it means it is a myeloblastic, not lymphoblastic. Okay, na? So they will ask the question that only type of AML which is treated by trans-retinoic acid. Trans-retinoic acid, that is the AML type 3. Okay, na? And it is also associated with the DIC. DIC disease. I think you guys know about this. Disseminated. Okay, now. So in the DIC, you'll see the everything is increases but the platelet count is decreases and there's a bleeding everywhere. There is a in the history they will give bleeding of subconjunctiva and also bleeding of gums, everything. If they only mention that there is only gum hypertrophy and only gum bleeding, then you have to think about the AML type 4 and type 5. Okay, na? Only gum bleeding, then only mark the M4, M5. If you are seeing everywhere bleeding, mark the AML type 3. Okay, na? And also, guys, AML type 7 is associated with the Down syndrome. What are the symptoms? We can see here all the symptoms: anemia, bleeding, everything. But what the main difference is that here we are having the organ infiltration, that we are having the bone involvement, lymphadenopathy. Okay, now we are having this one. Okay, see, this is all about the AML. You have to remember the AML 3, AML 4, S7. Okay, this one guys. The next one coming to the AML. The next one coming to the ALL. This is the most common in the children's. See, if you see the age 1 to 2 years, 3 to 5 years, or less than 10 years, just mark the answer as the ALL. Okay, na? So this one, first of all, you have to remember one thing. You have to remember most common is the ALL in children. So one MCQ done. Next one, most common syndrome associated with the ALL is the Down syndrome. It is the Down syndrome. So among the ALL types, L1 is the most common type and is the best prognosis. First is the best prognosis. Among the ALL type 3, it is the rarest and the worst prognosis. Okay, na? So we are having BLL, B lymphocyte. See, B, LLL and T lymphocyte, LL. See, we are having BALL, we are having TALL. So BALL, it is mostly occurs in the children's. But TALL occurs in the teenagers. See, T40, teenagers. BAL occurs in the children's. TAL occurs in the teenagers. In the BALL, we can see that we will see the CD10 positive, CD19, 20 cells positive, CD markers. Remember this one, guys. Always asking one questions, always. Okay, and the TAL seen in teenagers. You can also see the, we will see the mediastinal mass. Here this is the thymoma. This is thymic mass. Is in T for teenagers, T for TAL, T for thymic mass. We can also see the CNS involvement. ALL due to the hyperdiploidy. ALL also we can see the Philadelphia chromosome. What is Philadelphia chromosome? It is the T translocation of the 9 and 22. It is also seen in the ALL also. Okay, so what are the drugs we are going to use? We are going to use the, how to remember this one? VAP. Vapor. So VAP, vincristine, prednisolone, and the anthracycline. I think that. Next, coming to the CLL. CLL occurs in the old age. So guys, CLL occurs in the old age peoples. Okay, now. So it is the mature B cells. It is the tumor of mature B cells. If the history says that if the patient having history of autoimmune hemolytic anemia, then mark the answer as CLL. And also there is one criteria to diagnose the CLL is if the peripheral blood smear having more than 5,000 lymphocytes, and if the flow cytometry shows the CD5 positive and also CD23 positive markers, and also if the bone marrow biopsy shows that more than 30% lymphocytes, if you have these three findings, then mark the answer as the CLL. There is one thing is that if there is a CLL plus autoimmune hemolytic anemia and the ITP, then there is one syndrome, it is called as Evans syndrome. It is associated with the CLL, AIHA and ITP. One important thing is that here when you do the biopsy, we'll see there is a presence of the smudge cells. Smudge cells are seen in the CLL, not biopsy, I think. Okay, na? You will see the smudge cell in the CLL. It is due to the deletion of the 11, 13, 17 chromosome and the trisomy of the chromosome 12. That's all, guys. That's all for the leukemias, guys. So hope you will get the one MCQ. Thank you very much.